So different from non-Hodgkin's lymphoma is Hodgkin's lymphoma, which is a malignant condition of the lymphoreticular origin. And it's different because of the existence of specific cells called Reed-Sternberg cells, which are multinucleated giant cells. The most common symptom of Hodgkin lymphoma is a lump in the neck, usually in the neck or under the arm or in the groin, which is an enlarged lymph node. It doesn't usually hurt, but it can become painful after things such as drinking alcohol. The lump often grows larger over time, or there may be new lumps that appear around it or even in other parts of the body. General symptoms are things like fever, maybe some night sweats, weight loss again without really trying. You could have some itching skin, feeling tired, loss of appetite. And sometimes the only symptom is just being tired all the time. If you are, that doesn't mean you have this, but it is one of the primary symptoms. If this the Hodgkin's lymphoma affects lymph nodes inside the chest, the swelling of those lymph nodes could press on the windpipe and make a person cough or have trouble breathing, especially when they're laying down. So treatment is usually based on the stage of the disease, and the stages are the same as they are for non-Hodgkin's lymphoma. But also you consider a person's age, their health, where the lymphoma is, etc. So some of the treatments might be chemotherapy, radiation, immunotherapy, high dosage of chemotherapy, together with stem cell transplant. So this is just a picture demonstrating where the areas that they often find Hodgkin's lymphoma. So in these lymph node areas generally. Moving on to leukemia. It's a cancer of blood-forming tissues. There are different types. This can also include bone marrow, might be one of the tissues affected. Patients with the slow-growing leukemias really don't have symptoms, particularly initially. Rapidly growing leukemia may cause symptoms that include fatigue, weight loss, infections, easy bleeding or bruising. And treatment is variable depending on the type. For slow-growing leukemia, it can be monitoring. For more aggressive leukemia, treatment might be chemotherapy, followed by radiation, possibly stem cell transplant. So oftentimes you find leukemia in the gonads and the kidneys. Central nervous system can be affected. Lyme disease is one that's particularly important in this region of the area. It is a vector-borne disease. It's transmitted by an insect, and it is the most common tick-borne illness in the United States. It's, as I said, transmitted through infected ticks. It's the black-legged ticks that cause Lyme disease. Fever, headache, fatigue, and a characteristic skin rash called erythema migrans, and we'll talk about that in a second. If left untreated, this can spread to the joints, to the heart, and even the nervous system. Diagnosis is based on the symptoms and physical findings and whether there's the potential for being exposed to infected ticks. Even if you think you weren't exposed to ticks, you probably were if you're from anywhere in this general region. I've had ticks just fall on me walking under a tree. It's crazy how many ticks there are in this area. This is supposed to be a particularly bad spring and summer for ticks again this year. So it's important to be aware of this and what the symptoms are. Most cases of Lyme disease can be treated successfully with antibiotics, but how do we prevent Lyme disease? That's important. Insect repellents are helpful. You want to remove ticks quickly and possibly use pesticides. A trick, we have 2 dogs currently, 1 cat. We have a big yard. We are outside. we have ticks all the time. And the strategy that we found most effective for removing ticks is actually using, when a tick is embedded, using Anbesol, which is the oral numbing substance. And then what happens is you just use a Q-tip to dab it on the head of the tick, and it numbs the tick so it can no longer hold on. Because you don't want to tear a tick off and have the body separate from the head and have the head still embedded, because that can be a serious problem. You want to make sure you get the tick out whole. So we use the Anbesol, it numbs them, and then just use tweezers or rubber gloves with their fingers to pull the tick out. Now, ticks don't die very easily. You can't squish it like you can an ant or some of the other insects. So you have to crack the body, which is one way to do it if you're going to squish it. What we've started doing is actually microwaving the ticks. So wrap them in a napkin and microwave the ticks, and it kills them instantly. So, just some strategies over our many years of exposure and constantly having pets that get ticks on them and people that get ticks on them. If not treated, there can be a wide range of symptoms that are much more serious, depending on the stage of the infection, which can include fever, rash, facial paralysis, as you see in the picture. You could also, get arthritis. So if you have any of the symptoms and you've had a tick bite, or you live in an area known for Lyme disease, you want to see your doctor. So some of the early signs, 3 to 30 days after a tick bite, are fever, chills, headache, tiredness, achy joints and muscles, swollen lymph nodes, and this erythema migrans rash, which happens in about 70 to 80% of people infected, usually within about 7 days of exposure, and that's up here. That's what they call this bullseye rash, which is one of the classic diagnostic features of Lyme disease, but it occurs in 70 to 80, so there's 20 to 30% that don't get this. That rash can feel warm or painful to the touch, and it can clear as it enlarges, which causes that bullseye rash. But you still see the central location of where the tick bite is, and then that external ring around it. Later, if it's days to months after the tick bite, some of the signs and symptoms can include things like headaches, neck stiffness, additional rashes on other parts of the body, arthritis. Again, the facial palsy can happen much later, shooting pain, short-term memory problems, lots of joint problems associated with this. My son had this about a couple of years ago. It had been a long period of time, and he was at the point of having muscle pain, joint pain, some mental fog can happen. So it's important to be aware if you've been potentially exposed to ticks. And as I said, if you live in this region, you're potentially exposed to ticks. Generally treated with antibiotics, and it can be quite successful, particularly in the early stages. Later stages gets more difficult to treat, and there can be some lasting effects from the Lyme disease. This is just a chart that shows you the top 10 states that report Lyme disease, and good old Massachusetts is number 1, Connecticut is number 5, but you look at the New England states there were represented in this chart. Raynaud's disease is a rare disorder of the blood vessels, usually the fingers and toes. It causes the blood vessels to narrow when you're cold or feeling stressed, and I could add on here, oftentimes when you eat a hot meal or eat something, it causes your bodily fluids to go to your stomach to process the food, which causes the circulation to leave the areas of your extremities, which can cause, I know I have Raynaud's. This is one of the times that is difficult for me, is when during periods of digestion, I can get the blood flow away from my fingers that causes some issues. When any of this happens, regardless of what you're experiencing, the blood can't get to that surface of the skin, and those affected areas turn white and blue. When the blood flow returns, the skin turns red and throbs and tingles. Think of it as frostbite, like when you've been outside in the cold and you get frostbite. or, pre-frostbite. But a person with Raynaud's experiences it much more easily and much more frequently than people without Raynaud's. So primary Raynaud's is one type, and it just happens on its own. The cause isn't really known. There's also secondary Raynaud's that's caused by injuries or other diseases or medications. If people live in colder climates, they're more likely to develop Raynaud's. And it's also another one that's more common in women. There is a family connection. I have this, my daughter also has it. Treatment can include drugs to keep the blood vessels open. Simple things you can do yourself: keep your hands warm, try to avoid situations. I can't go, looking for something in the freezer without wearing gloves, because it's like experiencing hypothermia very quickly. You want to keep hands and feet warm and try to avoid triggers. Lupus is an autoimmune disorder that affects the joint, skin, kidneys, blood cells, brain, heart, and lungs. And symptoms can vary, but they generally include fatigue, joint pain, rash, and fever. And there are periods of flare-ups and periods of remission. Not any cure for lupus. A lot of the treatments focus on improving quality of life through controlling the symptoms and minimizing the flare-ups. And that can include things like lifestyle modifications, sun protection, because people with lupus tend to get sunburned very easily, diet management, anti-inflammatories and steroids. Can be treated with some drugs, and people can lead active, healthy lives. It is pretty complex. Cause isn't really known. They think some genetics, because there is, again, a family history, some environment, possibly hormonal, and it's kind of like a perfect storm that gets together to cause lupus. They haven't identified a specific lupus gene, but they do see that there is a family connection. Some of the symptoms, I said these already, but the classic one I didn't mention is this butterfly rash that you see in many people with lupus. Usually, it's on the face. It's a reddening of the area in the shape of kind of like a butterfly. They often have other symptoms or other comorbidities, such as having Raynaud's disease, can have anemia with it, may have seizures with lupus as well. Diagnosis can be difficult. It can take years. The classic test is the anti-nuclear antibody test, or the ANA, and generally, if you have a positive ANA, it can be indicative of having lupus. Doesn't always mean. You can have other autoimmune disorders and get a positive ANA as well, and people with lupus have gotten positive and negative anti-nuclear antibody blood tests. But other tests, generally the other testing that's done is to rule out other disorders. So maybe doing a complete blood count, urinalysis, doing some blood chemistries, etc. They also often do skin biopsies maybe and kidney biopsies as well. Treatments can be things like NSAIDs, corticosteroids, immunosuppressants, and oftentimes people with lupus tend to do alternative and complementary therapies as well. Quickly, we'll get back to fibromyalgia in the next brief recording because I don't have enough time.